Hi guys, this is Dr. Kalika here again, and like I say, we always show only real patients. That's why the patient's face are either covered or, in this case, Ethan is back to us, but he's a real patient. As you can see, he had a cervical spine arthritis and surgery, and we're going to tell the story. So Ethan, when did you have a surgery on your neck?
My surgery was a year ago in August of 2019.
Did the surgery help you?
Yes, it did, but it was temporary because I think there was a lot of scarring that went on. And about 4 months later, I started experiencing pain and couldn't understand why.
But now the pain is different from the pain you experienced prior to the surgery.
Yes. Completely.
So the surgery helped you, but had left an aftermath and you developed a different kind of pain.
Yes, no question. Yes.
Okay. And what did you do about the surgery? Did you about this pain? Did you consult your surgeon? Did he refer you somewhere else? Or
yes, I consulted my surgeon. He was very defensive. Insisted that it wasn't him, that it was a soft tissue problem. He sent me to a physiatrist, and the physiatrist prescribed a couple of rounds of physical therapy, traditional physical therapy. He also prescribed acupuncture. I had some chiropractic done, but quite candidly, nothing worked, and nobody has ever looked inside to see what was going on the way you just did.
okay, so now let me explain. So he had arthritis and osteoarthritis on his neck. And I think the surgery was successful. I don't think the surgeon did anything wrong. I think the surgery good. It relieved him of a lot of nerve pain you had in your hands.
Yes.
So, but the surgeries, they're not innocent. Every kind of surgery, even if performed perfectly, can leave aftermath, can leave other symptoms, especially spinal surgeries. They're very notorious for patients recovering for a long time, for failed back syndrome. But in case of Ethan, I don't see that. I think it's just that the physiatrist and the PTs didn't know how to look inside and how to see why he was having pain and why the pain changed. And what did make you choose to come to see me? Why you thought?
Yeah, I had been searching for solutions for months, and I actually just Googled to find somebody close by. And as it turned out, you had all of the right equipment and the right attitude.
Okay.
And gave me a lot of confidence to come and see.
Okay, great. So, so Ethan mentioned that he has scar tissue, and my experience, I have lots of patients over the years. I can't tell you how many patients come in and say, I've been to other physical therapy, other doctor, a physical therapist mostly, and they told me I have scar tissue. And I examine them, I look inside, and I say, you don't have any scar tissue. In case of Ethan, there is real scar tissue, and I'm going to show you how the scar tissue exactly is the problem. But in case of most of my patients that come in and they've been treated with a variety of different methods that supposedly work for scar tissue, the reality is if the soft tissue is stiff or perhaps it feels stuck, it doesn't mean you have a hard scar tissue. Scar tissue is real. You can see it on imaging, and if you don't see it on imaging, it's not a scar tissue. You can have densification of the fascia. You can also see it on imaging with high resolution ultrasonography. But that's a very different type of dysfunction, type of problem. In case with Ethan, there's real scar tissue, and we're going to show you how that scar tissue developed into a problem for Ethan. So I am on Ethan cervicothoracic junction, around C7, T1. I'm on the side that doesn't hurt. And if you look here, I'm going to point with the arrow. So we have skin, a little bit of fat, thickened fascia, muscle, fascia layer between the muscle, another muscle. So we are in the neck muscles, and I'm longitudinal. If you could see, my probe is like this. Now, this is the side that doesn't hurt. It doesn't look normal. There's densification of the fascia right here, but this is not a scar tissue, okay? And this is the side that doesn't belong here. Now, if I go across, watch my probe, I go across to this side, okay? Just to be fair, I'm going to go to where there's a problem. I'm coming back to this side. So I'm around the scar area where he has a real scar on the skin. So this is the right non-painful side. And now I go across. Look what's going on here. This is real scar tissue. All of this is real scar tissue. And if we ask Ethan to flex the neck, go ahead and. So this is scar tissue. That is the scar tissue. And if we try to find what I found before, because this is pretty much reenactment of what was an examination and sonography prior to that. So now I'm on the spine. So this is the spinous process. And this spinous process is higher than the one before, below the scar. So this one higher, so maybe it's wires that the surgeon put, I don't know, but this looks like a hardware. There's got a little artery there, you could see, and you could see all this tissue. And if he starts moving his head, rotate your head to the left, and come back, rotate to the left. I have to find what I found before, so give me a little time, guys. Go ahead. Now here. Okay. You could see the movement. There's the scar tissue. There I found it. Okay, now rotate. You could see this disorganization of all of this tissue. So this is abnormal. And I turn here, and you now twist the other way. This is normal. Normal. Abnormal. Okay, and if I turn the probe now, I turn the probe, this is the left side, this is the right side. We are on the spinous process, and if I go left to where his pain is, and I rotate, and come back, and again. You could see how there's so much scar tissue that there's a lot of rubbing. And there's rubbing on the hardware over the scar tissue. There's rubbing of the normal tissue over the scar tissue. And if I go to the other side, it looks completely different. So if I scan through the scar tissue, and he starts to move, so go ahead and move to the left. You could see all kinds of things colliding and hitting each other here. Yeah, and I go on the opposite side, he rotates, and it's just muscles. There's of course a little hard fascia here, but totally different from here. So in itself, scar tissue, it doesn't hurt itself. The scar tissue doesn't have pain receptor, it's a dead tissue. But all the muscles are touching here into the scar tissue. They're going to hurt. Yeah, scar tissue, I go, this is trapezius fibers. So these trapezius fibers are going to have, they're constantly under tension, because if you look to the scar, you could see this kind of zigzag. So obviously there's different tension on the muscles. He's developed trigger points here and abnormal mechanics. So scar tissue in itself does not cause pain in the scar tissue, but creates abnormal movement and causes pain in the muscles attaching to the scar tissue. So all in all, we're going to restore this, because I have multiple cases post-surgical with scar tissue, and they do wonderful if you know exactly how and where to intervene. So again, like I always say, clinical examination and sonography and very thorough assessment, looking at the structure and function, is extremely important. If you just look at function and don't look at the structure, you don't know what you're doing, and vice versa. And I think these two worlds of medicine just don't meet yet. Here's another case like that. Thank you.